he has such a good, noble cause of treating all the blood cancers totally free of cost. So, Dr. Ghulam Yasin speak upon role of homeopathy in factor 5 deficiency.
Bismillahirrahmanirrahim. Good morning. First of all, I would like to sincerely thank Dr. Tariq Aziz and his entire team for organizing such a great conference and for giving me this opportunity as a homeopath to present the role of homeopathy in curing serious blood disorders. This platform truly reflects our shared commitment to work together for the betterment of primary healthcare facility in Pakistan. Over the years, I have presented cases of pure red cell aplasia, hemophilia, aplastic anemia, ITP, and many other blood disorders. I am honored to present two successfully cured cases of factor 5 deficiency with homeopathic treatment. I have been working on blood disorders for the past 15 and a half years, arranging free medical camps for patients, and till now more than 1250 patients from across Pakistan are registered with us, covering nearly 13 different types of blood disorders, including blood cancers, PRCA, acute lymphoblastic leukemia, acute myeloid leukemia, chronic myeloid leukemia, and thalassemia major, thalassemia minor, hemophilia, factor 1, 5, 7, factor 8, factor 9. So we as a homeopath stand as frontline fighters along our allopathic colleagues, both in cities and remote areas, serving as family physician to ease the suffering of our nation and humanity. Today, I am presenting two rare and remarkable cured cases of factor 5 deficiency and invite you to look at the reports and see the difference that homeopathy has brought to their lives. First of all, we look at overview on factor 5 deficiency, a rare bleeding disorder also known as Oren, named after Dr. Paul Oren, who identified it in 1943, disease and parahemophilia, where the body has insufficient level of clotting factor. This condition can be inherited, congenital, or acquired, leading to symptoms ranging from mild bruising and nosebleed to severe and life-threatening hemorrhage. Most of the patients came to us with almost life-threatening conditions because a lot of blood deficiencies are there. So, basic symptoms of the factor 5 and hemophilia deficiency: easily bruising, nose bleeding, which is a serious illness to those children who are already low hemoglobin level, and bleeding from gums, stool, heavy or prolonged menstrual bleeding in females and in children, prolonged or excessive bleeding after surgery, trauma or childbirth. And सबसे पहले ये जो बच्चों में डायग्नोसिस का प्रोसेस होता है, वो जब इसके सर्कमसिजन करते हैं तो उस वक्त prolonged bleeding, it may refer to the patients for the HB and coagulation profile. So it's diagnosed as a factor 5, factor 8 or something else, factor 1 deficiency. Bleeding under the skin, which is called also petechiae, and in severe cases, life-threatening bleeding within organs such as brain, intracranial hemorrhage or gastrointestinal tract. You know that intracranial hemorrhage is really a severe illness. Diagnosis, you know better than me, and treatment management depends on the underlying cause. Congenital deficiency treatment often involves transfusion or fresh frozen plasma. That is the main treatment in traditional level. And acquired deficiency management focuses on controlling bleeding and eliminating the underlying cause or the factor 5 antibodies, which may require immunosuppressive therapy, and antifibrinolytic medication may be used for mild cases. And now we are discussing with homeopathic intervention, factor 5 deficiency treated with homeopathy. In our free medical camps, we came across a family with two siblings suffering from factor 5 deficiency. Date of first visit, 1st January 2023, patient, two siblings, sister and brother, and frequent hospital admissions for emergency bleeding episodes, impact on family, and parents were extremely distressed due to recurrent hospitalization and lack of permanent relief, and anxious for heavy economical burden and disturbance of other siblings. So this is Muhammad Anas, 1st January 2023, and factor 5 deficiency, you can see only 4%. It's Anas and 1.6 years aged at that time. In 2018, this test was performed, and after our 1 year and 8 month treatment, this report shows the factor 5 deficiency increased from 4% to 76% in just 1 year and 8 months. So that Ayat, his younger sister, and she also came to our camp on January 2023, and her report, her factor level was only 1%. And the date mentioned on 19 May 21, and after our treatment, her reports and her factor level goes to 72%, and 70 to 120 is a normal value of the factor 5 deficiency. So outcome after homeopathic treatment started from 1st January 2023 in our free camp OPD and end up in August 24, almost in 1 year and 8 months, but are still under observation. Both children became symptom free from last 1 year. No nosebleed, no bruise, no gum bleeding, no rectal bleeding, no hospitalization visits or required after our start of treatment. Both are now mentally and physically fit, enjoying normal childhood activities and their schooling. So we are just conclude our talk. These two cases demonstrate the potential role of homeopathy in managing rare coagulation disorders like factor 5 deficiency, and long-term follow-up shows sustained recovery without hospital dependency, and further research and documentation are required to establish homeopathy as a viable supportive therapy in rare blood disorder. हम अपने कैंप्स में 13 टाइप्स ऑफ ब्लड डिसऑर्डर्स डील करते हैं, और अल्हम्दुलिल्लाह हमारे पास बहुत क्योर रेशो है. आज हमारा 185th मंथली कैंप है, और अगर कोई देखना चाहे, इन बच्चों से मिलना चाहे, इनके माँ बाप से मिलना चाहे, यू आर मोस्ट वेलकम. थैंक यू वेरी मच डॉक्टर तारक अजीज एंड हिज टीम फॉर गिविंग मी अपॉर्चुनिटी. जी, इट्स अ डिफरेंट टॉक. हमारे पास बहुत सारे होम्योपैथी क्योंकि डिफरेंट है, हम पोटेंटाइज्ड मेडिसिन देते हैं, और बहुत सारी मेडिसिन हमारी ऐसी हैं जो प्लांट किंगडम्स की हैं, जस्ट लाइक आर्निका, जिसको आप आम रूटीन में पहाड़ी तंबाकू कहते हैं. इट्स अ हीमोस्टैटिक, और उसमें विटामिन के है, फिब्रिनोजिन है. तो हम अपने पोटेंसी के हवाले से, बच्चे की एज के हवाले से उसको जब एडजस्टमेंट करते हैं, तो विद इन 2 to 3 months उसकी ये सारी इन्फेक्शन और ब्लीडिंग जो है ना वो, और ब्रूजेस सारे और पेटिकी उसके सारे नॉर्मल हो जाते हैं, और विद इन द पैसेज ऑफ टाइम, विद इन 3 to 6 months उसके जितने भी फैक्टर लेवल है, या जितने भी जिस चीज़ की डेफिशिएंसी है, वो स्लोली ठीक हो जाती है.